So this event, I'd just like to introduce myself. I'm Michaela Morris. I'm the Dementia Programme Lead in Improvement Cymru, and would like to invite you, you're already here, so you're invited, but actually to welcome you to this promotional event for the Wales Dementia Friendly Hospital Charter, and for taking the time out of your busy schedules to join us today. So this event is being held as a celebration and a thank you to all those involved, and to tell you about the Charter and the work we have achieved together to improve dementia care in hospitals across Wales. So thank you, a huge thank you to the people living with dementia, their care partners, the hospital staff at all grades and all disciplines, the voluntary organisations, the academics, and all the people working in and connected to hospital care across Wales. Thank you very much for being involved. We'd also like to say a thank you to the Dementia Action Alliance and Sarah Tilzed, who started this work with us. And of course, the Alzheimer's Society Cymru and Sean Jones, who is an important part of the work that we have now and the work we have to do. And also the University of Worcester, the team there with Professor Dawn Brooker and Jennifer Bray, and Ian Bennett and his team at the Crystal Creative Digital Agency, who's supporting us on this journey. I'd also like to thank Diverse Cymru. The Welsh language, I don't know if anybody else heard that, but sorry if I affected your ears then. But yes, to go back, also like to thank Diverse Cymru and the Welsh Language Commissioner and everybody else who's been involved with us to get us as far as we have in this work over really challenging times. And there's a lot more to come. This is just part of the journey that we're talking about today. And then a final thank you to Frances Isaac for the most amazing, beautiful paintings that she's created for us to use on all our charter documents and the communications that will be coming out over the next year. So I have a background behind me, and you can see one of the paintings. So they're all images of hospitals from the outside. And that actually shows the community of people coming together. So thank you, Frances. They're absolutely brilliant. They're beautiful paintings. So today at this promotional event, we're celebrating the co-production and the development of the Charter, which has helped us to get to this next phase. We're calling this the testing, trialling phase, which we're promoting today. We have a great agenda for you, and we'll now be providing a short presentation to give you a bit of flavour on the background to the Charter. So I'd like to introduce you to Sean and Rebecca. So Sean.
Hi everyone, I'm Sean from Alzheimer's Society Cymru, and I'm a Public Affairs and Campaigning Officer, and it's great to be here with you all this afternoon.
And then Rebecca.
Hello everybody, my name is Rebecca Hammer. I'm one of the Senior Improvement Managers in Improvement Cymru, and it's great here to be with you all as well. Thank you, Michaela.
And so we're a very small team, but I hope perfectly formed. So thank you. There's a huge thank you here, obviously from us, this very small team, to all of you that have joined us today and all of you that have been part of this journey with us. So I'd like to hand over to Sean, who's going to take us through the beginning of the presentation. Thank you, Sean.
Diolch yn fawr, Michaela, and diolch everyone. So as many of you on this call will know, the All Wales Pathway of Standards was launched this year, and Standard 11 mentions that Wales is to adopt the Dementia Friendly Hospital Charter with a regular review of implementation and outcomes. The purpose of the Charter will be outlined in the document itself, which will be launched in spring 2022. At the heart of the Charter lies the aim to enable hospitals to create a dementia-friendly culture, experience, and the right environment for people with dementia, their families, and their carers in Wales. The Charter provides a focus for people living with dementia and their carers whilst they're in hospital, and outlines the care, treatment, and understanding expected to achieve the vision of the Dementia Action Plan. The implementation of the Charter is also something which is one of the solutions mentioned in the cross-party group on dementia, is a report on hospital care in Wales. This report will be formally launched when the group meet virtually next week, and we look forward to its findings. If you could go to the next slide, please. The Charter focuses on the following areas and what we would like to see supported once the Charter is implemented. The Charter aims to enable hospitals to create a dementia-friendly culture, experience, and the right environment for people with dementia, their families, and their carers. It will also focus on improvement and offer a short, accessible, and visible statement of principles that contribute to a dementia-friendly hospital. It will build on the needs of people with dementia and their families and carers and what they can rely on when they access a dementia-friendly hospital. The Charter will be built on the foundation offered by the Royal College of Nursing Staff, Partnership, Assessment, Care and Environment Principles, also known as the Space Principles. And finally, it will offer an implementation framework to assist hospitals in their self-assessment against the dementia-friendly principles. And I'll now pass over to Rebecca.
Diolch, Sean. As mentioned in the previous slide, the Dementia Friendly Hospital Charter for Wales builds on the foundations offered by the Royal College of Nursing's staff, principles, assessment, care and environment space principles. SPACE is a set of 5 principles that form a shared commitment to improving care for people with dementia and their families. Based on evidence gathered from people living with dementia, carers and practitioners, each principle is considered essential to ensure the appropriate delivery of care. Developed by the Royal College of Nursing and updated in 2019, the principles are designed for use in a wide range of health and social care settings and are used to inform the Charter. During the Charter consultation, stakeholders felt there were 2 extra principles were required. Therefore, volunteering and governance are included. And you can see these 2 extra principles at the bottom of the slide. Next slide, please. So we will now trial the Care Fit for VIPS platform, which is an assessment tool to ensure that person-centred care is in place for people with dementia. The VIPS assessment tools help staff and organisations rate progress and stands for V for values people, I for individuals' needs, P perspectives of people using the service, and S supportive social psychology. This will be trialled in nominated wards across Wales from November 2021 to February 2022. Next slide, please. From January to February 2022, the feedback and the suggestions received from all nominated wards will be analysed. And following this, the Care Fit for VIPS platform will be updated accordingly. In March 2022, the Wales Dementia Friendly Hospital Charter will be going live. Health boards across Wales will then adopt the Charter and commence local delivery plans covering April 2022 to March 2023. Over to you, Michaela. You're on mute.
Sorry. So what you see here on the timeline is the Charter's journey. So it started way back in 2019 and it takes you right through to the launch that we're expecting in the spring 2022 and also the work that's going to be expected beyond that. So from the workshops to the Hospital Charter Steering Group, stakeholders from across different sectors have played a crucial part in co-producing the Charter, with the steering group comprising of clinicians, people affected by dementia, carers, charities and many more. So the Improvement Cymru Dementia Care Inpatient Practitioner Network has met several times throughout this period and has undertaken tasks and answered many questions to help with shaping the Charter, to ensure that the up-to-date concerns and the issues relating to dementia care within hospitals is brought to the table by the staff across our care settings in Wales. And this will be reflected within the Charter and its supporting documents. So once launched, the Charter will align with the key documents and legislation within Wales, and some of these will include documents such as the Wales Dementia Action Plan and the Welsh Government Dementia Recovery Plan, the Health and Care Standards Framework, Social Services and Wellbeing Act, the Wellbeing of Future Generations Act, the Mental Health Wales Measure, and Mwy na Geiriau, More Than Words, 2016. So next slide, please. So Improvement Cymru has been working with University of Worcester, who developed the Care Fit for VIP platform, along with a web company, to incorporate elements of the Charter principles and the self-assessment definitions. So Crystal, who are the creative digital agency, have come up with the branding and the layout for the platform, and we're working very closely with them still. Above is an example. On the screen you see an example of what you could expect to see on the page when you log into the platform and start to undertake the trial. Next slide, please. Also on the page, on the slide here, you can see another example of what the interface of the CareFit VIPs tool will look like when you start to undertake a self-assessment to determine what dementia care looks like in the ward or the setting where you're working. So this platform and how you use it will form part of the trial that we're going to be undertaking with the nominated wards across Wales. Thank you, Sue. Next slide. So this is the end of our little presentation, and we've got another couple of presentations that I think are going to be really interesting for you all. And we would be interested to see if anybody is wanting to join our inpatient practitioners network. Can you please email Christina Oakes, as it says there on the screen, and she will add you to our list, and then we can actually engage with you about doing some more in-depth work around hospital inpatient care. So after today, we'll be sending you out also a Padlet. This is our communication link, and this will contain all the slides that you're seeing today and the recordings today, and plus other resources that can help promote dementia care within hospitals. So diolch, thank you, and we're so pleased to be sharing this journey with you today. We still have a long way to go, but we're halfway there because we're working together. So thank you, Sue, for sharing the slides. Could we now take them down? Thank you. And I would like to now introduce Lynn Neagle, the Deputy Minister for Mental Health and Wellbeing, who is going to provide a few words about the Charter and the work that has been undertaken. Many of you on the call today have been part of this journey. So it will be really, really pleasing to hear the commitment and the message from Lynn Neagle, our Deputy Minister. Thank you, Lynn.
Thank you very much, Michaela, and can I thank you all for joining today to hear about the Wales Dementia Friendly Hospital Charter and its progress. I would really have loved to have been there in person today to meet you all, but given the public health situation, unfortunately, that's not possible. But I am really pleased to have the opportunity to be able happening across Wales. There's been some fantastic work undertaken to develop the Charter principles and the new self-assessment dementia care within hospital settings. Now, support for those living with dementia is very close to my heart from my own personal experience, just how important having the right person-centred care in hospital is for those living with dementia families. So I can see how valuable this work will be and the impact it can make. I'm delighted that the Charter in spring 2022, but today is an opportunity for us all to learn more about the Charter and the next phase of work. Over the last 2 years, we've all faced our own individual as a result of COVID. In particular, the health and social care sector, extreme pressures and challenges, and unfortunately it's likely these will continue. The response to the COVID-19 pandemic has shown what we can achieve when we work together for a common goal. The dedication shown by health and social care, the third sector, people living with dementia, their families in supporting and helping vulnerable people has been and continues to be really inspiring. The work on the Charter is this dedication and commitment. Practitioners throughout Wales did and work together to understand the needs while working to improve the hospital experience for those living with dementia and their carers. The Charter is part of a wider approach to dementia, complements the All Wales Dementia Standards and Dementia Action Plan. It also already underway across Wales to deliver a joined up approach to supporting people living at home and having the right measures in place admission and reduce the As we've heard, the Dementia Friendly Hospital Charter has been led by Improvement Cymru and co-produced Action Alliance, Alzheimer's Cymru, those dementia, carers and practitioners across Wales. The Charter sets out principles, as we've heard, using the SPACE model, staff, partnerships, assessment, care and environment, and the principles document, which we've seen a little of, living with dementia and their carers, what they can expect when receiving hospital care. It will outline the vision and purpose and how the workforce will respond and deliver. Within the Charter, there is a Charter vision and principles document, and I'm pleased to say scope to developed by all stakeholders in March 2022. There's also the Charter Readiness Guide. This will help the regional dementia boards to develop their readiness and their implementation plans for adopting the Charter throughout 2022 and early 2023. Finally, it's good to know that there's an online platform, Care Fit for VIPs, which will enable those to self-assess current practice and undertake improvement initiatives. Work has been undertaken to version of this platform to meet Wales' specific needs. The next phase of this work will involve wards across Wales undertaking a trial of the Care for VIPs platform during the winter months to test its effectiveness and in settings in Wales. In practice, this Charter should make sense to those living with dementia. We know that going into hospital can be really difficult for people living with dementia. Faced by anyone going into hospital, dementia can also be faced with challenges and the disruption to usual routines, which can be really stressful and distressing. This is why our workforce requires enhanced learning and development opportunities to support caring for those with dementia and their carers. The Charter will be vital in supporting people when they need care within a hospital. How empowered, enabled and cared for is crucial in providing a hospital experience, and properly preparing our workforce to deliver this is essential. We know there is a long way to go in changing for the better the experience of those in hospital who are living with dementia and their carers. This Charter is one step in the right direction to meet the ongoing challenge we are facing. I'm hugely grateful for the positive, co-productive and inclusive approach which has been taken in rising to that challenge. I'm also hugely grateful for those giving their time and sharing their own experiences to help us build this work to improve dementia care within hospitals and make it better for everyone. It is truly inspiring. So a heartfelt thank you to all of you for your time and work in this area and for listening today. I hope it is as it is to me to the launch of the Charter. Diolch yn fawr.
Thank you, Lynn. Thank you so much for your kind words and your supportive words, and also acknowledging the commitment shown by all those people that have been involved during these difficult times. It has been a delay to where we've wanted to be, but actually we've got to where we are now, where we're able to trial the platform so that we can embed it into practice throughout 2022. So I'd just like to thank you again for joining us today and for saying those so kind words. One of the things we always say is together we achieve together, we aspire together, we inspire together, and then we'll get there together. So that's our bit of our motto. Thank you very much, Lynn. And we'll now move on to the next part of our event today. So I'd like to welcome Nigel Huller and Kerry Higgins, who are going to take us through the next presentation on co-production and the Dementia Friendly Hospital Charter. So thank you, Kerry, and thank you, Nigel. I'll leave it to you to introduce yourselves. Thank you.
Thank you, Michaela. My name is Nigel. I live with dementia in the People's Republic of Townhill in Swansea. And I'm so pleased to be part of this event today. Kerry, would you like to say a few words about yourself before we start?
I certainly would. Hi, good afternoon, Pnawn Da. I'm Kerry Higgins. I'm an NP carer and part of the Lleisio Dementia Network, having been caring for family and friends with dementia for 30 years. And I'm delighted to be part of this charter and of this afternoon.
Okay, go to the next slide, please. My belief is that the pathway to happiness and a life of quality is geared around fulfillment. And these should not be disappeared in the presence of dementia, old age, frailty, or illness. And there are certain things that allow this happiness and fulfillment to occur. And one of them is co-production. When implemented correctly, the idea of co-production should have the power to achieve positive change. The negotiated shift of power should be welcomed in a way ensuring that such relationships are based on care that is practical, therapeutic, and can flourish. Kerry will talk a little bit more about this a bit later. And to help us get us there, we work very closely in a co-productive manner with Improvement Cymru, and you've heard all the agencies that have been involved with us, but centre to all the discussions have been the experiences of people living with dementia. I won't go through the agencies because that's been spoken about. The Charter will improve the experiences of people affected by dementia in hospital care settings. An experience that will recognise their personal diversity and preferences and is shaped by recognising the importance of dignity, respect and kindness. Three very well used words throughout the Charter, and three very well used words in all the discussions that we've had. The Charter follows the principles of the National Dementia Action Plan and the Dementia Standards for Wales, and it helps develop the person-centred approach which is embedded in both. Shaping a choice of meal times. This list is not exhaustive. We all know what happens when people go into hospital care sometimes, that they have to adapt a whole new environment which they don't understand. Sometimes they find difficulty coming to terms with. But we're hoping that the Charter will allow people to look at things like the choice of meal times, letting people go to sleep and wake up when they want to, more flexibility on visiting times, making sure the care is delivered in a culturally sensitive way. One of the messages in the Charter is that care staff, nurses and doctors and whoever's involved in the care of an individual develops what's called cultural curiosity. Find out a little bit more about people's backgrounds, histories and preferences, and therefore frame your delivery of care around that knowledge. Making sure relatives and friends are fully engaged in loved ones' care and not relying on filling in forms like "this is me," which is very important, but actually involving people in the care in a very proactive way. Facilitating a more adaptive environment, less clinically themed and more comfortable for people affected by dementia. But this is a challenge in itself. But if you know someone has dementia, if you know the principles of what makes people happy, you also know what makes people unhappy. So value contrast and value the person, because one size doesn't fit all and one approach doesn't fit all. We're hoping the impact of the Charter. We hope the impact will be to provide a short, easily accessible statement that describes the pathway a truly dementia-friendly hospital environment and challenges and looks at the culture. Next slide, please. And one category of the culture is organizational culture. Our society is made of many types of organizations: political, faith-based, professional, academic, environmentalist, etc. Organizational culture consists of values and beliefs that are shared by its leaders, then shared and reinforced in different ways to shape understanding, contact, and perspectives. More so, never more so than in the health service. Good leadership is almost a given. It has to happen. It's the only way that change can happen. If we are given good leadership, or if people are given good leadership to take cultural change forward. The approach to nursing and care in hospital settings for people living with dementia must continue to evolve. And I know there's been a lot of work going on around this to form from a traditional task-based, oriented culture to one that is person-centered and embraces and respects identity. Such change can be difficult to manage and may encounter considerable opposition. Understanding change management and leadership styles may help make this transition easier. The hospital charter will provide a template for the differences between task-oriented and person-centered care, and the theories of management that underpin it, and the motivation and the leadership styles. And will focus on those that are most appropriate for this type of change. An improved understanding of these theories will enable everyone to support others in the delivery of person-centered care. I often finish these things with a quote. My go-to person is Winnie the Pooh, but I won't do it this time. I won't do Winnie the Pooh this time. What I'll do is talk about Maya Angelou, and she says that people may not recognize you. People may not know who you are. People won't recognize what you've done, but they will never, ever forget how you made them feel. Thank you very much. Kerry.
Thank you. And as Nigel said, I'd just like to speak to you a bit about co-production. But can I just share something really important with you all today? When we say that people living with dementia and carers and families, people with lived experience have been co-producing the charter, I genuinely mean that we have come together with fledgling ideas and planted very small seeds. Now those seeds have now grown, being nurtured into the tree that you see behind us. And that tree has branches that reach out into people's lives across health boards, local authorities. So co-production, I'm just going to give a very, very brief definition. So co-production is an asset-based approach to public services that enable people providing and receiving services to share power and responsibility and to work together in equal, reciprocal and caring relationships. Co-production isn't just about services, it's changing how we work to make sure we do things together. A different solution to meeting people's care and support needs. This is about a different relationship and a different culture. Why is a co-produced dementia-friendly hospital charter so important, and the benefits of a co-produced response? Co-production places people at the heart of delivering and planning. It saves money and changes lives. Now, I'll now describe a very small piece of evidence, of research that evidence that. It suggests that services that co-produced activity support stronger relationships and reduce stigma, reporting a reduction in the need for routine and emergency health intervention due to an increase in physical and mental well-being. Co-production has a powerful impact on people's sense of competence, autonomy, relatedness, and on their personal, social, and emotional capabilities. These are all fundamental to our ability to experience positive life outcomes to maintain well-being. and to achieve person-centred care. There are clear links between patient health and well-being and the environment of a hospital. There is evidence that the built environment can influence the healing process and have a direct impact on patient outcomes. So to evidence this, I would like to share a few thoughts from our members of people living with dementia and carers across our networks in Wales. And I thank them kindly for their very open and honest thoughts. And we would like you to consider these as you consider the charter going forward within your work. A member shares, when creating your work streams and having discussions about your environments and the wider context of the charter, if they are not meaningfully co-produced with unpaid carers, people living with dementia, all you are creating is a hospital environment you think we need. A second thought shared by a member. Within a hospital setting, dementia is typically defined in the medical context. There's an overwhelming necessity when living with dementia to consider other aspects and other models. And lastly, before I pass over to Nigel, see if he has any final words, I'll share the final quote from a member. No service providing treatment and care should aim for excellence in one hand and in the other take away from the person's health and well-being, impacting the individual's experience within a hospital setting. So our key message here is that in relation to co-production, it's not about doing to or doing for, it's about doing together. And I think you'll agree that with the benefits that we have shown on these slides, that in the current climate across health and social care, that we cannot afford not to co-produce services. Nigel, any final words? Thank you.
Just to say this, Kerry, and a great presentation as usual. To all the audience out there, to everybody, you can't change my dementia. I've got it, that's it. But with a bit of thought, a bit of confidence, and a change of direction, you can change the world in which I live. And I thank you very much for that. Thank you very much. Thank you very much, everybody.
Diolch yn fawr iawn.
Oh, thank you very much, Nigel. Thank you very much, Kerry. And that was such a powerful message. And I think you've laid down a challenge for all of our work streams and all of our work in dementia care to be co-produced. So a great challenge and an important message for our work streams as well. Thank you very much. I'd now like to invite Professor Dawn Brooker to come and provide us with a really another inspiring presentation regarding caring for patients with dementia in hospitals. So thank you, Dawn.
Michaela, thank you very much. I warn you, I am having a few internet problems. It just went off and on. So it may be that I was very impressed with Rebecca talking earlier about Care Fit for VIP. So maybe Rebecca, you'll have to step in and do these slides. So fingers crossed we'll be okay.
Thank you, Dawn.
Thank you very much, Michaela, and all the team. You've done some fantastic work to get this project to this point as it stands, and particularly Nigel and Kerry, thank you for that presentation. It makes my job here much easier. So next slide, please. For those of you who don't know me, my name's Dawn Brooker. I'm a professor of dementia studies. I'm also a clinical psychologist, and I've worked in dementia care for around 40 years now. And one of the things I sure know is delivering person-centred care, particularly within acute hospital wards, is a really tough job. There's no one in the world that gets this right all the time, and there's no one in the world that gets it right on a sustained and maintained basis. It always feels like we're pushing that big boulder up the hill, and as soon as we take our pressure away from pushing to make sure that the experience of being in hospital for people with dementia is a reasonable one, as soon as we stop pushing, that boulder rolls back down and we're right back to task focused and unperson centered care. And I think, you know, some of the things that Nigel and Kerry were talking about, being in hospital if you have a dementia is a really tough, frightening, scary experience. If you're a family member who is supporting somebody that's in hospital, it's really tough, scary and anxiety provoking. If you're a member of staff and you're trying your best to do a good job with all of the different priorities that are showering down on your shoulders, it's a really difficult job to do. So I come today with a bit of humility and thanks and say, you know, my job is to try and put my shoulder to the boulder with you. What I try to do is to articulate our evidence base for person-centered care and give us a few tools that might not make that work feel less overwhelming. So I could have the next slide, please. So great. So I've got two books here. The first one was written in 1997 by a guy called Tom Kitwood, that if you've been around in the area of dementia care for any length of time, you'll know that name. When Tom Kitwood first wrote that book, a series of articles back in the 1990s, it caused a seismic shift in how, as professionals, we looked at the lives of people living with dementia. I was working at the time as a jobbing psychologist, and reading Tom's work, which was now doesn't seem revolutionary. It's about, you know, let's try and understand what it might feel like to have dementia, and to recognise that that people with dementia are people first, and that a lot of the problems that they encounter from care services is when they are treated like non-people. You know, it's quite a simple message, but it had, in that 1997 book, he laid down a theoretical underpinning for why it was so important that we recognised the personhood of people living with dementia. And 20 years on, I had the privilege of reviewing, of doing a second edition of that book with a lot of people who are big names within dementia care, including people living with dementia, in order to review the evidence base. And I think what we've got 20 years on from Tom Kitwood's theoretical perspective is we now have the evidence to say, actually, this is right. This makes a real difference in people's lives. Next slide, please, Sue. So if you're into heavy theory and you really want to dig deep into person-centered care and personhood, then please read the Tom Kitwood, read the updated version, because you'll have lots of other intellectual thoughts around it as well. But if you want an easy read, go for this publication, which really was trying to take the work that was laid down by Tom and to turn it into a sort of practical definition that we could use in our practice in hospitals, in communities and in care home. And as Rebecca said, you know, this is, well, it's care fit for VIPs, very important people. But it was really saying, you know, if you're going to be delivering person-centered care, that's a bit different to just delivering individualised care. It's actually got to be care that really values the experience of people living with dementia. It's got to recognise that individuality, but it's certainly got to try and look at the world from the perspective of the person living with dementia and provide that supportive social environment that we know helps people to feel less confused and less anxious. So next slide, please. So here we have the at the beginning of the NICE guidelines, we've got that V, I, P and S, those that definition of person-centred care was in the 2006 guidelines, and it's also in the 2018 guideline. And for those of you that have been involved in NICE guideline, nothing gets in there unless it's got an evidence base. And I think that's really important to remember about person-centred care. This isn't just being sort of nice, and it's not just sort of a moral imperative to look at people's personhood. It also leads to better health and social care outcomes. So if people feel valued, if services value people and their families, regardless of age or cognitive impairment, they will have better health and social care outcomes. If people are treated as individuals and we recognise that their personality and their life experience influence their response to dementia, they'll have better outcomes. If we understand that importance of perspective and really try and put ourselves in the position of what it might feel like to be receiving acute hospital care, we'll provide better outcomes. And if we pay close attention to those relationships and interactions, if we do the Maya Angelou, you know, recognising how we make people feel as the first rule, then we'll have better outcomes. So next slide, please. So as an individual practitioner, you know, whether you're a doctor doing a memory assessment, whether you're a nurse, you know, doing a leg ulcer, or you're a healthcare assistant helping somebody to eat their food, or an OT doing a home visit, you know, these are those 4 guiding questions that you use as a reflection to say, am I working in a person-centred way? And those things should be in your mind, in your everyday work. And if you keep those at the forefront of your mind, you'll still have times when you don't achieve it, but you're much more likely to achieve it if you're using those sorts of reflective questions. Next slide. So on the last slide, we looked at those reflective questions that we can ask as an individual care practitioner, whatever our role in providing that support. But the next piece of work that we did with that framework is to say, okay, can we apply those principles across a whole care organisation? So let's think of a hospital, for example. And Nigel talked very eloquently about the real importance of leadership in this area. And I think, you know, that's a term we use a lot in organisational culture, but we have to be very clear on who is leading on what. Okay, so there are some things, particularly if we think about how an organisation values the experience of people living with dementia, the human resource management, the management ethos, the training, staff development, the buildings, the quality assurance, the governance. Those are real things that will go through the organisation to value people, and those are set in place and led by the directors, the senior managers, the senior leadership team. Individualised care, you know, care pathways, reviews, possessions, preferences, life stories, activity, occupation. Those are very often led by clinical leads. So, you know, the dementia lead, the modern matron, because all of those things need processes putting in place. They need resourcing if they're going to happen on a regular basis within a hospital environment. Then you've got those perspective type indicators, the communication, the empathy, the risk, physical, how we manage our physical environment and physical health needs, how we look at so-called challenging behaviour or distress behaviours, whether we look for the reasons beyond it rather than just trying to manage it, and advocacy. If your shift leaders, if your senior sister or ward manager isn't on that, then those things won't happen. And then we've got our social, psychological, interaction type things: inclusion, respect, warmth, validation, enabling, engaging with family. And that's got to be the responsibility of everybody in contact with a person living with dementia. Final slide, please. So you can get the book, it's a good read, but we've also put it all on, as Rebecca and Michaela said, on a web platform that we've been using now since about 2012. And that takes those indicators of person-centred care and enables you as a practitioner to assess, you know, how are we doing on all those indicators? Are we doing these really well, or do we need more work? And we've got versions here. We started with versions in originally in care homes, but we've developed through co-production hospital, domiciliary care, daycare and community support. And the really exciting thing for me is that we're getting to really now drill down into the hospital version of this in support of this charter, which gives us the opportunity to really update this website and make it fit for the next 10 years too. So thank you everybody for listening. That was a whistle-stop tour. If you want to stay in touch with the work that we're doing at Worcester or join our mailing list, then you've got details there. Thank you very much.
Oh, thank you so much, Dawn. That was brilliant. A really, really good, I think, inspiring and supportive message for us. And obviously, we can't underestimate the importance of person-centred care, can we? It is the key. It's the key for us to be able to take this forward. It's challenging. We're going to have some challenges, I think, in how we take it forward at the pace perhaps we want to, but we'll get there, I'm sure, because, you know, people want to work in this way. People really want to deliver the best they can possibly deliver. So I think our job, as you've articulated, is very much how we support people to do that, and we learn together. So thank you very much again, Dawn. I'd like to now introduce Professor Katie Featherstone from the University of West London. Obviously, Katie used to work with us a lot in Wales, and you're now over there working in England, but you're still connected heavily into our work. So Absolutely. Thank you, Katie, for joining us today.
Well, thank you very much for welcoming me today. And absolutely, I think, you know, I am now in West London, but that's because University of West London absolutely have such a strong commitment to research in the field of dementia, but also importantly to improving care. And they've really embraced the work that we're doing. But absolutely, we really hope to keep our strong connections with Wales. And I also want to say that really, I think Wales is such a leader in this field. And that's why one of the reasons I really want to keep working with you. I mean, the leadership of Lynn Neagles, Sue Belps, Rebecca and Michaela, but also all the hospital leadership and across the health boards, and also staff in Wales are really committed to improving hospital care. Next slide, please. Thanks, Sue. And I'm just going to really give you a very quick overview and of the wider field of research before I talk about our work. One thing that we do know in terms of the evidence across England and Wales is over the last decade, this real increase, as we've seen an increase in the population of people living with dementia and diagnosed with dementia, we've got this increased population in our hospitals, which I think really took hospitals by surprise, and they really haven't, as organisations, made that shift. As Nigel and Kerry said, that kind of organisational culture hasn't shifted to support this group. So we've seen this increased rise of numbers of people with dementia and inpatient days and use of beds. So in the audience, obviously, we've got lots of people who work in wards, are leading wards, and most nurses in charge of wards that I see say that about a third of their hospital beds are someone living with dementia. Sue, next slide, please. And I think it's also really important to recognise that this is a population. These are people living with dementia who are typically at the early and mid stage of their diagnosis and often undiagnosed. So they're not there because they have their dementia, they're there because they have an unplanned admission with a potentially preventable and treatable condition. For example, pneumonia, sepsis, UTIs, and of course fractures. So they really need to be in our hospital wards and cared for by specialist teams. But these are treatable conditions, so this population should be going home. Sue, next slide, please. However, what we find is this group have really, really poor experiences and really poor outcomes. So the risk of dying during an admission or shortly after admission within 30 days is incredibly high. And if we have identified 2 people who are admitted for the same condition, acute condition, the person living with dementia will be at twice the risk of dying compared to a person without dementia. So they really are at high risk here. Sue, next slide, please. And we have absolutely seen some really important responses from the NHS in terms of recognising this is a population that needs extra care, needs specialist care. And what they've done is really think about it in a kind of organisational way, which kind of goes back to Nigel's point earlier, really thinking about designing new types of wards and also classifying patients in different ways. So thinking about care of the elderly, rapid assessment wards, wards for people with cognitive impairment, a focus on frailty, but also thinking about the decor and how wards look, to see dementia friendly in almost just kind of one aspect of those wards. Sue, next slide, please. Hospitals have also done an awful lot of outsourcing of skills. So rather than supporting staff in wards to develop their expertise in caring for someone with dementia, what we often have is very small, highly specialised teams who are seen as the experts. So we might have one highly specialised sister. We might also have these small teams, but of course they can't cover the entire hospital population of people with dementia or support all wards. So that's a very kind of, it doesn't really support everybody in our wards. We also have a lot of use of enhanced one-to-one care and agency care for people with dementia. And again, this is outsourcing and seeing the care of people with dementia as belonging to other groups and part of the wider hospital responsibility, rather than supporting staff in wards to develop those skills to care for this population. We also have a lot of identification and awareness schemes. Often these are about labelling people, for example, purple slippers or butterflies. There is no evidence base for those at the moment, but again, it's a reactive response from institutions, rather actually thinking about what people living with dementia need and also what staff need to support them in their work. Sue, next slide, please. And what we really need, and which really kind of informs the work that we do, is actually we need to look at what's happening in our wards now. How can we develop interventions until we really understand ward cultures and how wards operate in the response and how they respond to the care of people with dementia. So interventions must reflect how wards are organising and delivering care. And until we do that, we really won't find the ways to really, really intervene and support staff properly. We need to do the detailed foundational research that examines and shows us how work is done now, rather than how NHS managers might see work as imagined. And the issue of hospital culture is really critical. We see cultures across hospitals, but also individual wards have their own particular cultures. And we need to look at what's happening in these wards. What are the cultures, the things that are, the way we do work here. This is the way it is. This is how we do care here. We need to look at that and actually go, how can we support staff to see how they might do things differently? Next slide, please, Sue. So in response, we focused on carrying out two studies funded by the Department of Health. The first was looking at resistance and refusal of care as something that was a real issue raised by family carers, but also ward staff, people with dementia resisting or refusing food, medication, personal care. So we did a detailed study looking at that. The second study focused on continence care. Of course, this is work that is a really central part of ward work and ward life, but it's very, very invisible, but also is really, really central to personhood, identity for people. We need, our continence is central to who we are and feeling like a person. Next slide, Sue. So to carry out these studies, colleagues and I, we've spent 360 days, this is of course pre-COVID, examining work, shadowing staff, shadowing nurses, shadowing healthcare assistants, talking to people living with dementia, talking to carers. We were there for 360 days across a couple of years, really just being in wards and observing everyday care, the often very invisible care that isn't really seen, and really talking to staff about everyday work. All of this work as well was in collaboration with people living with dementia and families, and nurses and healthcare assistants as well. See you next slide. And one thing we really found is that it goes back to Nigel's point about organisational culture. And where we found really high quality care, it was where organisationally and at ward level, staff felt they could work at a slower pace, that the timetables were more relaxed, and where individual patients' timetables could be recognised. Rather than waking everybody up at a particular time, actually seeing individual needs, and also taking time to listen to individuals, to patients, to people, to families. And once those timetables became relaxed, when there was a slower pace, what we saw were actually teams really starting to see the person at the bedside, and it also enabled them to start supporting independence. So, for example, supporting people to leave the bedside, to walk to the bathroom with support, to walk in the wards, to eat independently. And that became really, really central to those kind of calmer, more relaxed, supportive ward environments in the acute setting. We also recognised across all the wards that we were in, actually the staff frustration, that they really didn't feel they were able to deliver the high quality care they wanted to deliver, then actually the organisational cultures were really really restricting them from delivering the care they wanted to deliver. And that frustration of not being able to give the person-centred care they wanted to give. See, next slide, please. We published this quite widely, but a key publication is our book, Wandering the Wards, which covers all of the studies that we've carried out so far. And that's totally open access, so anyone can download that for free. Sue, next slide, please. And we're using our research in a number of ways. And I think this is really the importance of the work that is going on across Wales. Welsh policy is it's really nice to be able to take the research directly to policy. It's really also great to deliver it in terms of capacity building, working with teams to deliver training. But of course, training isn't enough. And I think the work that Michaela and Rebecca are doing in terms of supporting ward staff, in terms of community of practice, and thinking about those small ways that wards can take charge and think about how they might change their practice, how they might change the pace, is really central. If we can, to really improve the care in hospital wards, to improve it for people living with dementia, we also need to improve the circumstances, the way care is delivered, the way staff that can deliver care. We need to improve the circumstances for ward staff as well. So next slide, please. So where next? Well, I think again, Wales is leading the way in this. The the policy directives on reducing restrictive practice is a first. And in response to that, we're hoping to announce that our next study will look at restrictive practice in everyday care. And really, again, it's about supporting people with dementia, but also supporting ward staff. And again, that's a very detailed piece of research that we're going to start in the new year soon. Next slide, please. We're also interested in looking at diagnosis as well. There is a lot of diagnosis being carried out in the acute setting by non-experts. So we really need to think about how we might support training for staff, but also that delivery of the assessment, diagnosis, but also disclosure of those sorts of diagnoses and their consequences. Sue, next slide, please. And thank you very much. I really hope to continue working with you all in Wales. Thank you.
Thank you very much, Katie. That was a brilliant presentation. It's actually taken us through the reality of care within and life within a hospital setting, but the reality for our workforce as well, and what's needed really. The evidence is showing us, isn't it, how we can change, what we need to focus on to change. So thank you very much, Katie. Do you want to stop the presentations now, Sue? Thank you. So I'd like to invite now Sue Phelps, who's the County Director Wales for the Alzheimer's Society Cymru, to join me and actually close the session today. It's been absolutely brilliant that we've had so much engagement, quite outstanding really. And this is our first engagement event around in-hospital care for people with dementia. So I think we'll connect so much more as we go through this next 12 months, but I'd just really like to say thank you all for joining us today. Sue, would you like to say some words?
I would. Thank you, Michaela. And I'm going to park what I had prepared because I'm mindful of time and people need to get to
don't worry.
For the end of the day. But so really, what I wanted to do was to thank everybody, and oh my goodness, what a buzz there is around the charter. So I'm going to start with a quote actually, and this comes from the hospital inquiry report that was commissioned by Lynn, the minister at the time, who was chair of the cross-party group, and she asked Alzheimer's Society to look into the standards of care on hospital wards in Wales. And one of the quotes that came from a person affected by dementia is, I'll read it so I get it right. All staff that my mother came into contact with in the general hospital, and especially accident and emergency, had no idea how to approach a patient with dementia. And that was a carer who was looking after her mum. I think what the charter is going to do is address exactly that and put us in a much better place in Wales to be able to respond to the challenges, to changing that culture that Katie was talking about within our hospital settings, and to improve standards across the piece so that people affected by dementia, whether they're living with a diagnosis or whether they're carers, have a much more positive experience during their stay or visit to hospital. So I'd like to thank I'd like to thank colleagues in Improvement Cymru. I'd like to thank colleagues living with and affected by dementia like Kerry and Nigel and others who have absolutely been at the heart of this work. I'd like to thank Lynn for her continued support and leading the way. And I think actually what Katie said really resonated with me in terms of Wales is blazing the trail as far as this is concerned. Sarah, who is a valued former colleague from Alzheimer's Society, really led the work in England, and we grabbed the baton in Wales and we've run with it. And we're, I think, really making fantastic headway on how we can make a difference and provide that person-centred, individualised care that's been spoken about today in our hospital wards. So I won't go on other than to say that it's Diwali today and it's Guy Fawkes tomorrow. So I genuinely think that we should be looking at the fireworks when we go out, if we go out, and looking at them as a means of celebrating what we've achieved to date, and to mark what we're going to achieve going forward once the charter is launched in March. And I, like Rhiannon, are really excited at the prospect of launching the charter in Wales and delivering against a dementia-friendly hospital charter to make such a difference to the lives of people affected by dementia. So thank you. It's been a privilege being involved in the work. I look forward to continued work and to, like I say, continuing to blaze the trail as we do so well in Wales. Thank you. Diolch yn fawr.
Thank you, Sue. And I suppose it's the closing remarks, really. I just still want to really sort of press home the amount of work, the amount of commitment that we have seen from so many people from across Wales. We know it's been hard. This journey started long before COVID did. It's just delayed us a little bit, and that's what I call everything at the moment is we're just delaying. But the commitment, even through the pandemic, of all the staff, you know, we've had so many people join our inpatient practitioner network. They're working on really busy wards, busy environments, but they really show that commitment to wanting to make the change, and more importantly, wanting to learn. And we always say in Improvement Cymru, in our dementia care programme, that we learn together, we achieve together. And that's really, you know, how I want to sum it up, because we've all learned something on this call today by the different people that have presented. And I think that's just sums up really what our programme is all about in Improvement Cymru with our partners, because we could never do this without our partners. And you're all our partners, every one of you on this call. So thank you.